We'll look at some couple of dislocations, and this dislocation is basically the dislocation around the shoulder. We are generally trying to look at all the dislocation in the upper limb. Okay, all the dislocation in the upper limb. So, we're looking at that of the shoulder. Okay, so usually occurs when the upper arm, that's the head of the femur. Look at this. The femur is supposed the humerus is supposed to be in the glenoid cavity. You could call that the glenoid fossa. So once that head of the humerus slips out of that socket, you have what is known as a shoulder dislocation. Okay. So it's actually one of the most common dislocated joints in the body. Usually occurs when you fall, when you do all those sports that, from contact, you know, and immediate medical attention is very important in this though. Okay. So types of shoulder dislocation include a dislocation where the head of the humerus is moving forward. That's anterior dislocation. Look at this. Anterior dislocation is moving forward. Posterior dislocation is going to the back. Inferior dislocation is going downward. Okay. So we have anterior dislocation, we have posterior dislocation, we have inferior dislocation. Okay. Then sometimes you have what complete or partial subluxation. This one, um, the bone is just out of place, but not really that far. Okay. So that's what we have. Okay. Anterior dislocation, posterior dislocation, and inferior dislocation. So general symptoms include there's a lot of pain, and of course, there's inability to move the arm very well, and there's a visible deformity. Okay, or you feel as if the shoulder is appearing out of place. Swelling, bruising, and muscle spasms. There's also numbness and tingling in the arm or hand. That usually comes in when the nerves are affected. So you diagnose this using physical examination to check for deformity, blood circulation, and nerve function. Then also X-rays to now confirm the dislocation and rule out other fractures. Then also MRI or CT scans if you feel like there's a soft tissue or labrum damage. So you treat it using, you know, a trained person has to actually what help you, you know, get the, you know, stuff back in place. Then they immobilize you. That means they basically keep that part of the body in one place. They can use a splint or a sling. The pain management using all those NSAIDs. The physical therapy where gradual exercise is just to restore the range of motion. Then if the dislocation keep coming back or the ligaments are torn or fracture accompanies the injury, they can actually do a surgery like all those repair of the labrum, okay, tighten the ligament, okay, just to rearrange the place.